Hey everybody, Dr. Rob here, Facebook Live. Really got an exciting topic to share with you today. As everybody knows, and I've talked about many times and I lecture about it every week, I love to speak about gut permeability, gut health, and the gut-to-brain axis in health and disease. So one of the things that I rely on as a great marker and a baseline marker is this specific test for overall gut health. But more than just gut health, we always want to assess antigen intestinal permeability. So it's more than just a leaky gut. So let me wheel it back a little bit in. As everybody knows, your gut is 80% of your immune system. It's where your macro and micronutrients are absorbed. It's the key to overall health, or one of the biggest keys to health. Your gut and your brain communicate with each other. It's a bi-directional communication. It communicates in two different fashions. Communication number one is something called the vagus nerve, parasympathetic nerve number 10. What a great nerve. It is the key of the parasympathetic nerves. It is your rest and digest nerve. Your vagus nerve actually attaches to the outside of your intestinal wall. And with that, it senses things going on, something that you'll see, a term we'll use called dysbiosis, and it signals to your brain. It's able, your gut, to communicate with your brain within a millisecond. So gut health is critical and can immediately turn good things on and bad things on with that communication. In addition, whatever's in your gut doesn't stay in your gut. So as I like to say, the gut is not Vegas. What happens in the gut doesn't stay in the gut. And speaking to the idea of intestinal permeability. So I use this particular test as a critical, once again, baseline to ascertain a patient's health and where they are and where they can possibly go. So this happens to be what we call Cyrex array number 2. So let's take a look at the first thing, which is lipopolysaccharides, or as I'll call it for the rest of our Facebook Live, LPS. LPS holds the gram-negative bacteria on the inside of your intestinal tract. Gram-negative, just inherent by the name, for the most of you, the name gram-negative, a great example would be E. coli. So LPS holds this E. coli on the inside of your intestinal tract. Now, when LPS is exposed, it gives you the idea and leads to the idea that you have something called endotoxicity. So this bacteria, LPS, releasing this gram-negative bacteria, leads you down a path of what we'd like to refer to as leaky gut. What causes this leaky gut? Well, for LPS and LPS IgG, IgA, and IgM, which we're going to touch upon in a second, something called dysbiosis, an unleavening of good and bad bacteria. That unleaveling of good and bad bacteria, believe it or not, we should be at a point where we have 85% or more good bacteria to bad bacteria. If we don't have that percentage, we have an unleaveling, and we call that gut dysbiosis. Gut dysbiosis really refers to the idea of having too much gram-negative versus gram-positive bacteria. Positive for health, negative typically negative for health. In addition, systemic LPS is now released. Now, systemic LPS can cause a plethora of issues. Systemic LPS, or LPS being released, leads to systemic inflammation in multiple joints, the brain, the thyroid, the liver, musculoskeletal health, big on that. As a chiropractor, leaky gut, damage to musculoskeletal health. For all my chiropractic brethren out there, brothers, and for all those patients out there, understand that if you have a musculoskeletal injury, please have someone wheel it back in and take a look at your gut and your gut health. So here is your LPS and your gut dysbiosis. In addition to lipopolysaccharide, we also want to test for IgG, IgA, and IgM. They're antibodies. So you're looking at antigen intestinal permeability. They're critical element in antibodies. So let's go through these three different ones. So IgM would imply, I always use the M to apply early activation. I use the M like in morning in my head, early activation. IgA is reactivating, and IgG means ongoing. So I never want to test just LPS. I always want to test LPS with these antibodies. Now, just so you all know, within this LPS, IgG, IgA, and IgM, if you've got a compromise, you come into my office, it takes anywhere from 1 to 3 months to correct it. So there's a time frame to it. It's very, very critical because of that systemic inflammation. Now, if we have an LPS problem, it's conceivable that we may also have a tight junction problem. So let me explain that. Here's everybody's gut right over here. Everybody's gut, it should be in what we call a semi-permeable membrane. When it becomes too permeable, when I open up my fingers, when it becomes too permeable, we have something called leaky gut. Now there's these little gateways called the tight junctions. When they're damaged or they break down, that's called tight junction issues. Two of the main proteins you can test for are gluten and zonulin. So when these are expressed, we know that there's an elevation, there's a damage to the tight junction structure. Once again, we always want to test the tight junction structure with IgG, IgA, and IgM. What can damage or lead to this tight junction problem? Tight junction damage leads or can be caused by stress, chronic dysbiosis, right over here, non-steroid anti-inflammatories, Aleve, Advil, and ibuprofen. They don't just cause leaky gut, they damage your tight junction. Unfortunately, when they also damage your tight junction, they can also damage your cell membrane also, because gut on fire will lead to brain on fire. NSAIDs, non-steroid anti-inflammatories, decrease pain, they impair healing. The idea of using nutraceuticals, good quality nutrients, will also decrease pain, but improve healing. And finally, overall systemic or overall inflammation. That inflammation can damage the tight junctions. Let's take the next step over. By the way, tight junction, you can take up to 6 months to fix this. I just gave a talk down in the city. It was at a restaurant, and it was interesting in that talk, when I told people, very few doctors, unfortunately, are not taking these tests, although more and more are starting to. It is a baseline. So all you patients, give me a call. So many of your practitioners are starting to get exposed to really understand the idea of leaky gut, tight junction, and now actomyosin. Actomyosin implies epithelial cell damage from chronic gut dysbiosis, celiac disease, the allergy to gluten. So let's speak a little bit about that. About 1 in 100 people have an allergy to gluten. About 40% have a sensitivity to gluten. The other 60% still should not eat gluten. Gluten means glue, sticks to your intestinal tract, will damage your gut and raise all these markers. So everybody always adhere, I say it every week, to my GPS of health. No gluten, no processed food, no sugar. IBD and IBS, irritable bowel disease, irritable bowel syndrome, so IBS, IBD, and SIBO, small intestinal bacteria overgrowth, raging. There should not be a lot of bacteria in your small intestine, and a lot of that SIBO is attributed to a decrease in the vagus nerve and too many people being sympathetic and a multitude of other things. With the actomyosin and IgA, you could be conceivably having autoimmunity at the gut level. This could take up to 12 months. Now with these markers, I've been able to set a standard with a lot of different patients, apply my 7R program, which I'm very happy to share with you at some point. And it's also my 6R is in my book, Inside Out Health. My 7R is in my upcoming book, which we're going to be announcing in a couple of months. A lot about the gut-brain axis. Nevertheless, here are 3 specific markers that I recommend with IgG, IgA, and IgM. We call this Array 2, a standard bearer for anybody doing the gut-to-brain axis in health and disease. So I know we have some questions. I got a couple of Steph, you moved your finger a few times, so what do we got?
Okay. Why do we have to test for a broken barrier instead of a food test?
So why do we have to test instead of a broken barrier instead of a food allergy test, I think is what they meant. So it's very interesting. There are some great food allergy tests. The reason is that you can still have an intact barrier and have some food allergies. But the best idea is, for me, the suggestion I always recommend is test for a broken barrier. See if that barrier is broken, fix the barrier, and then do your food allergy testing. So the broken barrier, some people have food allergies. Remember, foods typically pass the barrier most. It's when they're really big and clumpy they shouldn't and can cause the issue. So my suggestion is test for the barrier first. After you fix the barrier on a retest, then do some food allergy testing, because food allergies can cause leaky gut, but leaky gut certainly can cause food allergies.
Okay, and the second question, LPS levels and zonulin levels alone versus them with antibodies.
Okay, so the question's great question. A lot of docs ask me that. She said LPS and zonulin by themselves versus the antigen levels, the antibody levels. Why? Well, real simple. LPS and zonulin fluctuate within a few hours daily. Every few hours daily. So you're going to have to take a multitude or multiple blood tests to really get accurate readings. You want to take IgG, IgA, and IgM because when you test for these antibodies, this is a much longer marker, a much more accurate marker, and you're also testing for what? Possible autoimmunity. So I don't like any of the tests with the including the zonulin and LPS by themselves because of their fluctuation over a few hours every day during the day.
Okay, the next question is, what other tests can they take and why do you recommend them?
Oh, what other tests can they take and why do I recommend it? Well, this is Array 2. This is really testing gut health, if you will, in essence, to laymanize it, if you will. I'm a big believer, since we talked about the gut-to-brain barrier, I believe in testing for brain health and brain barrier health. That's Array 20 because when your gut's on fire, your brain's on fire. It's your gut and your brain are made out of the same proteins. So very typically in that bidirectional communication, if your gut's damaged, your brain's damaged. So once you get a positive here, you should probably go right up to Array 20 and check for the blood-brain barrier. Incidentally, there's some articles that now say the first sign of Alzheimer's is the compromise of the blood-brain barrier. We got anybody to say hi to? Any more questions?
We have on Facebook Matt Johnson. He says, I love your presentation at SWIS.
Ah, Matt Johnson, thanks. That was Swiss. I was just up in Toronto in Swiss. We had a great time. It was a packed house and hope to do it again. Big shout out to Ken. I know we're trying to push him for 2020. That's it. All right, guys, everybody. Steffi will kill me if I don't do this. Please, everybody, leave a comment, like it, share it. Let me know what you think. Let's get the word out. This is a critical element. This is a critical test for everybody's over health. Remember, you have to ask yourself a question. Do you have the guts to be healthy? And what have you done for your guts lately? Dr. Robbo is yours in health.